Right. So we have learnt this evening that Prime Minister Boris Johnson, as you say, has been admitted to hospital. This is after having symptoms of the coronavirus for the past 10 days, which he tested positive for. It's worth mentioning that it's not an emergency admission. Currently, we just know that he has been admitted to hospital for tests, and that's pretty much the extent of it. A spokesperson from Downing Street has released a statement saying that he was admitted to hospital on the advice of his doctor, and it's been described as a precautionary step that has been taken because of the persistent nature of his symptoms. But interesting that he still remains very much in charge of the business of government and is still in contact with ministers and officials.
As the coronavirus spreads around the globe, so is a series of equally viral scams, cashing in on the crisis. Tarek Saleh is a malware researcher in Seattle. He found this app, which promises to alert Android users when they're in a coronavirus hotspot. Instead, the program locks the phone and demands a ransom from the user. There are also offers for vaccines, in-home tests, and a $50 patch that immunizes you from the virus, though in fact there is no vaccine, no in-home test, no patch. In one scam, callers ask consumers who are desperate for government stimulus checks to give numbers to credit cards and bank accounts, which are then looted.
Tonight, from the Surgeon General, that dire warning.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives.
Health officials telling everyone to avoid leaving the house at all costs. If you absolutely have to go out, wear a mask and keep your distance.
This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe.
This as the national death toll tops 9,000.
This is war. This is essentially what it feels to be like a wartime position.
From a doctor on the front lines in Michigan, one of the hot spots health officials caution is just days away from reaching a deadly peak.
We are struggling to get it under control.
The French government is looking at geolocating people infected with COVID-19 as a way of ending confinement restrictions. An infected person would input their COVID-positive status on an app so people they meet as they walk around could be warned. Several companies, including Orange, are looking at developing the app. A person's movements would be tracked via Bluetooth. Registering with such an app would not be compulsory. French authorities cannot impose it. Another question being asked is who would see the massive data being accumulated? One survey suggests if the app is created, 1 in 4 French people would fear surveillance would continue after the epidemic is over.
A Defense Department official tells Fox News the Navy captain who was relieved of command of the USS Theodore Roosevelt aircraft carrier has tested positive for coronavirus. 50-year-old Captain Brett Crozier was fired from his position after writing a letter saying the virus had created a dire situation on board the carrier. It ended up in the hands of a San Francisco Chronicle reporter who first reported its contents last week. Navy officials say some 155 sailors on the Theodore Roosevelt have now tested positive for COVID-19.
Over a course of a week, we had 4 tigers and 3 lions develop mild respiratory signs. They were coughing, some of them were wheezing. After a couple days of that, when Nadia began not eating well, we anesthetized her for the purpose of treating her and taking care of her and doing testing to determine what was wrong. As New York City is in the middle of, this COVID pandemic and we're the epicenter for the U.S., it was logical to wonder and worry whether she could have been infected too. So she was test positive, and it surprised everyone because that hadn't been documented before.
Le Forestier's pharmacy in Libreville is a lot busier than usual. Many customers are demanding one thing: chloroquine. Despite a lack of clinical evidence, a lot of people in Gabon believe the anti-malaria drug can be used to treat coronavirus. It's a similar situation in Burkina Faso. Rasmane Ouedraogo bought a large amount, which he plans to use with local remedies just in case he catches the virus. Chloroquine is cheap and has been used to treat malaria for decades. Small studies in France and China suggest it may help to limit the effects of the virus. Health officials in Burkina Faso, Cameroon and South Africa have authorized hospitals to treat patients with the drug. And a Senegalese doctor says using chloroquine to treat coronavirus patients is effective, but only in hospital.
We're so grateful because this is a new virus, and the only ones who can really tell us how to handle it are those who fought it on the ground, and those are the people in China.
This is life for the next 2 weeks. Quiet streets, traffic-free roads, silence. An estimated population of 21 million people are being told to stay indoors. But unlike the rest of the world, time has allowed Nigeria to prepare. It's been nearly 4 weeks since the first case was confirmed, and so far there have been less than 140. This stadium, now converted into an isolation centre, is waiting for patients. Whilst there's confidence at the top, there's concern on the front line. 2 out of every 3 people live in a slum in Lagos, where basic hygiene and social distancing is impossible, and there's a real fear that the poorest will suffer the most.
It is the latest challenge to face weary Venezuelans. This country, which has the world's largest proven oil reserves, is chronically short of gasoline. In the last 2 weeks, all gas stations have been taken over by the police and National Guard. Fuel is only being distributed to those that need it for official use, mainly medical staff and the security services. In Caracas, tempers were beginning to fray over who goes first. This doctor said he'd been waiting 3 days to fill up.
I understand that security is a priority now, but if 50 security vehicles are allowed through and just 2 from the medical sector, how are we meant to look after patients?